Physical therapy. A physiotherapy is a physical medicine and rehabilitation specialty that remediates impairments and promotes mobility, function, and quality of life through examination, diagnosis, prognosis, and physical intervention. It is performed by physical therapists. In addition to clinical practice, other activities encompassed in the physical therapy profession include research, education, consultation, and administration. Physical therapy services may be provided alongside or in conjunction with other medical services. Overview. Physical therapy attempts to address the illnesses or injuries that limit a person's abilities to move and perform functional activities in their daily lives. PTs use an individual's history and physical examination to arrive at a diagnosis and establish a management plan and, when necessary, incorporate the results of laboratory and imaging studies like X-rays, CT scan, or MRI findings. Electrodiagnostic testing may also be used. PT management commonly includes prescription of or assistance with specific exercises, manual therapy and manipulation, mechanical devices such as traction, education, physical agents which includes heat, cold, electricity, sound waves, radiation, rays, prescription of assistive devices, prostheses, orthoses and other interventions. In addition, PTs work with individuals to prevent the loss of mobility before it occurs by developing fitness and wellness-oriented programs for healthier and more active lifestyles, providing services to individuals and populations to develop, maintain and restore maximum movement and functional ability throughout the lifespan. This includes providing therapeutic treatment in circumstances where movement and function are threatened by aging, injury, disease or environmental factors. Functional movement is central to what it means to be healthy. Physical therapy is a professional career which has many specialties including sports, neurology, wound care, EMG, cardiopulmonary, geriatrics, orthopedics, women's health, and pediatrics. Neurological rehabilitation is in particular a rapidly emerging field. PTs practice in many settings, such as private-owned physical therapy clinics, outpatient clinics or offices, health and wellness clinics, rehabilitation hospitals facilities, skilled nursing facilities, extended care facilities, private homes, education and research centers, schools, hospices, industrial and workplaces or other occupational environments, fitness centers and sports training facilities. Physical therapists also practice in the non-patient care roles such as health policy, health insurance, health care administration and as healthcare executives. Physical therapists are involved in the medical legal field serving as experts, performing peer review and independent medical examinations. Education varies greatly by country. The span of education ranges from some countries having little formal education to others having doctoral degrees and postdoctoral residencies and fellowships. History. Physicians like Hippocrates and later Galen are believed to have been the first practitioners of physical therapy, advocating massage, manual therapy techniques and hydrotherapy to treat people in 460 BC. After the development of orthopedics in the 18th century, machines like the gymnasticon were developed to treat gout and similar diseases by systematic exercise of the joints. Similar to later developments in physical therapy, the earliest documented origins of actual physical therapy as a professional group date back to Per Henrik Ling, father of Swedish gymnastics, who founded the Royal Central Institute of Gymnastics in 1813 for manipulation and exercise. The Swedish word for physical therapist is psykgymnast, equals someone involved in gymnastics for those who are ill. In 1887, PTs were given official registration by Sweden's National Board of Health and Welfare. Other countries soon followed. In 1894, 4 nurses in Great Britain formed the Chartered Society of Physiotherapy, the School of Physiotherapy at the University of Otago in New Zealand in 1913, and the United States' 1914 Reed College in Portland, Oregon, which graduated reconstruction aides. Since the profession's inception, spinal manipulative therapy has been a component of the physical therapist practice. Modern physical therapy was established towards the end of the 19th century due to events that had an effect on a global scale, which called for rapid advances in physical therapy. Soon following, American orthopedic surgeons began treating children with disabilities and began employing women trained in physical education and remedial exercise. These treatments were applied and promoted further during the polio outbreak of 1916. During the First World War, women were recruited to work with and restore physical function to injured soldiers, and the field of physical therapy was institutionalized. In 1918, the term reconstruction aid was used to refer to individuals practicing physical therapy. The first school of physical therapy was established at Walter Reed Army Hospital in Washington, D.C. Following the outbreak of World War I, research catalyzed the physical therapy movement. The first physical therapy research was published in the United States in March 1921 in the PT Review. Quote, "In the same year, Mary Macmillan organized the Physical Therapy Association. In 1924, the Georgia Warm Springs Foundation promoted the field by touting physical therapy as a treatment for polio. Treatment through the 1940s primarily consisted of exercise, massage, and traction. Manipulative procedures to the spine and extremity joints began to be practiced, especially in the British Commonwealth countries, in the early 1950s. Around this time, when polio vaccines were developed, physical therapists have become a normal occurrence in hospitals throughout North America and Europe. In the late 1950s, physical therapists started to move beyond hospital-based practice to outpatient orthopedic clinics, public schools, colleges, universities, health centers, geriatric settings, rehabilitation centers, and medical centers. Specialization for physical therapy in the U.S. occurred in 1974, with the orthopedic section of the APTA being formed for those physical therapists specializing in orthopedics. In the same year, the International Federation of Orthopedic Manipulative Physical Therapists was formed, which has ever since played an important role in advancing manual therapy worldwide. Education. Educational criteria for physical therapy providers vary from state to state and from country to country, and among various levels of professional responsibility. Most U.S. states have physical therapy practice acts that recognize both physical therapists and physical therapist assistants, and some jurisdictions also recognize physical therapy technicians or aides. Most countries have licensing bodies that require a physical therapist to be a member of before they can start practicing as independent professionals. Physical therapists United States. The primary physical therapy practitioner is the physical therapist who is trained and licensed to examine, evaluate, diagnose and treat impairment, functional limitations and disabilities in patients or clients. Physical therapist education curricula in the United States culminate in a Doctor of Physical Therapy degree, but many currently practicing PTs hold a Master of Physical Therapy degree, and some still hold a bachelor's degree. Currently, the education programs for physical therapy have changed. The Master of Physical Therapy and Master of Science in Physical Therapy degrees are no longer offered. and the entry-level degree is the Doctor of Physical Therapy degree, which typically takes 3 years. PTs who hold a master's or bachelor's in PT are encouraged to get their DPT because APTA's goal is for all PTs to be on a doctoral level. WCPT recommends physical therapist entry-level educational programs be based on university or university-level studies of a minimum of 4 years, independently validated and accredited. Curricula in the United States are accredited by the Commission on Accreditation in Physical Therapy Education. According to CAPTE, as of 2012 there are 25,660 students currently enrolled in 210 accredited PT programs in the United States. The physical therapist professional curriculum includes content in the clinical sciences. Current training is specifically aimed to enable physical therapists to appropriately recognize and refer non-musculoskeletal diagnoses that may, presently similarly to those caused by systems not appropriate for physical therapy intervention, which has resulted in direct access to physical therapists in many states. Postdoctoral residency and fellowship education prevalence is increasing steadily with 219 residency and 42 fellowship programs accredited in 2016. Residencies are aimed to train physical therapists in a specialty such as acute care, cardiovascular and AMP pulmonary, clinical electrophysiology, faculty, geriatrics, neurology, orthopedics, pediatrics, sports, women's health, and wound care, whereas fellowships train specialists in a subspecialty, similar to the medical model. Residency programs offer eligibility to sit for the specialist certification in the respective area of practice. For example, completion of an orthopedic physical therapy residency allows its graduates to apply and sit for the clinical specialist examination in orthopedics, achieving the OCS designation upon passing the examination. Board certification of physical therapy specialists is aimed to recognize individuals with advanced clinical knowledge and skill training in their respective area of practice, and exemplifies the trend toward greater education to optimally treat individuals with movement dysfunction. Canadian physiotherapy programs are offered at 15 universities, often through the university's respective College of Medicine. In the past decade, each of Canada's physical therapy schools has transitioned from 3-year Bachelor of Science in Physical Therapy programs that require 2 years of prerequisites university courses to 2-year Masters of Physical Therapy programs that require prerequisite bachelor's degrees. The last Canadian university to follow suit was the University of Manitoba, who transitioned to the MPT program in 2012, making the MPT credential the new entry to practice standard across Canada. Existing practitioners with BSCPT credentials are not required to upgrade the qualifications. In the province of Quebec, prospective physiotherapists are required to have completed a college diploma in either health sciences, which lasts on average 2 years, or physical rehabilitation technology, which lasts at least 3 years. To apply to a physiotherapy program or program in university, following admission, physical therapy students work on a Bachelor of Science with a major in physical therapy and rehabilitation. The BSc usually requires 3 years to complete. Students must then enter graduate school to complete a master's degree in physical therapy, which normally requires 1.5 to 2 years of study. Graduates who obtain their MSc must successfully pass the membership examination to become member of the Ordre Professionnel de la Physiothérapie du Québec. Physiotherapists can pursue their education in such fields as rehabilitation sciences, sports medicine, kinesiology, and physiology. To date, there are no bridging programs available to facilitate upgrading from the BSc PT to the MPT credential. However, Research Masters of Science and Doctor of Philosophy programs are available at every university. Aside from academic research, practitioners can upgrade the skills and qualifications through continuing education courses and curriculums. Continuing education is a requirement of the provincial regulatory bodies. The Canadian Alliance of Physiotherapy Regulators, or simply known as the Alliance, offers eligible program graduates to apply for the National Physiotherapy Competency Examination. Passing the PCE is one of the requirements in most provinces and territories to work as a licensed physiotherapist in Canada. The Alliance has members which are physiotherapy regulatory organizations recognized in the respective provinces and territories. Government of Yukon Consumer Services, College of Physical Therapists of British Columbia, Physiotherapy Alberta College Plus Association, Saskatchewan College of Physical Therapists, College of Physiotherapists of Manitoba, College of Physiotherapists of Ontario, Ordre Professionnel de la Physiothérapie du Québec, College of Physiotherapists of New Brunswick, College des Physiothérapeutes du Nouveau-Brunswick, Nova Scotia College of Physiotherapists, Prince Edward Island College of Physiotherapists, Newfoundland and Labrador College of Physiotherapists. The Canadian Physiotherapy Association offers a curriculum of continuing education courses in orthopedics and manual therapy. The program consists of 5 levels of training with ongoing mentorship and evaluation at each level. The orthopedic curriculum and examinations takes a minimum of 4 years to complete. However, upon completion of Level 2, physiotherapists can apply to a unique 1-year course-based master's program in advanced orthopedics and manipulation at the University of Western Ontario to complete their training. This program accepts only 16 physiotherapists annually since 2007. Successful completion of either of these education streams and the respective examinations allows physiotherapists the opportunity to apply to the Canadian Academy of Manipulative Physiotherapy for fellowship. Fellows of the Canadian Academy of Manipulative Physiotherapists are considered leaders in the field, having extensive postgraduate education in orthopedics and manual therapy. FCAMPT is an internationally recognized credential, as CAMPT is a member of the International Federation of Manipulative Physiotherapists, a branch of the World Confederation of Physical Therapy and the World Health Organization. Physical therapist assistants. Physical therapist assistants may deliver treatment and physical interventions for patients and clients under a care plan established by and under the supervision of a physical therapist. Physical therapist assistants in the United States are currently trained under Associate of Applied Sciences curricula specific to the profession, as outlined and accredited by CAPTE. As of August 2011, there were 276 accredited 2-year programs for physical therapist assistants in the United States of America. According to CAPTE, as of 2012 there are 10,598 students currently enrolled in 280 accredited PTA programs in the United States. Curricula for the physical therapist assistant associate degree include anatomy and physiology, exercise physiology, human biology, physics, biomechanics, kinesiology, neuroscience, clinical pathology, behavioral sciences, communication, ethics, research. Other coursework is required by individual programs. Physical therapy technicians or aides. Some jurisdictions allow physical therapists to employ technicians or aides or therapy assistants to perform designated routine tasks related to physical therapy under the direct supervision of a physical therapist. Some jurisdictions require physical therapy technicians or aides to be certified, and education and certification requirements vary among jurisdictions. Canada. In the province of Quebec, physical rehabilitation therapists are healthcare professionals who are required to complete a 3-year college diploma program in physical rehabilitation therapy and be member of the Ordre Professionnel de la Physiothérapie du Québec in order to practice legally in the country. Most physical rehabilitation therapists complete their college diploma at Collège Montmorency, Dawson College, or CE Acute GEP Marie-Victorin, all situated in and around the Montreal area. After completing the technical college diploma, graduates have the opportunity to pursue the studies at the university level to perhaps obtain a bachelor's degree in physiotherapy, kinesiology, exercise science, or occupational therapy. The Université de Montréal and the Université de Sherbrooke are among the QUE Acute BE Acute COI's universities that admit physical rehabilitation therapists in the programs of study related to health sciences and rehabilitation in order to credit courses that were completed in college. United States. Job duties and education requirements for physical therapy technicians or aides may vary depending on the employer, but education requirements range from high school diploma or equivalent to completion of a 2-year degree program. ONET reports that 64% of PT aides techs have a high school diploma or equivalent, 21% have completed some college but do not hold a degree, and 10% hold an associate degree. Employment. Physical therapy-related jobs in North America have shown rapid growth in recent years, but employment rates and average wages may vary significantly between different countries, states, provinces or regions. United States of America. According to the United States Department of Labor's Bureau of Labor Statistics, there were approximately 198,600 physical therapists employed in the United States in 2010, earning an average $76,310 annually, or $36.69 per hour, with 39% growth in employment projected by the year 2020. The Bureau of Labor Statistics also reports that there were approximately 114,400 physical therapist assistants and aides employed in the United States in 2010, earning an average $37,710 annually, or $18.13 per hour, with 45% growth in employment projected by the year 2020. To meet the needs, many healthcare and physical therapy facilities hire travel physical therapists, who work temporary assignments between 8 and 26 weeks for much higher wages, about $113,500 a year. Bureau of Labor Statistics data on PTAs and techs can be difficult to decipher, due to the tendency to report data on these job fields collectively rather than separately. ONET reports that in 2011, PTAs in the United States earned a median wage of $51,040 annually, or $24.54 hourly, and that aides techs earned a median wage of $23,680 annually, or $11.39 hourly in 2011.